Dr. Eric here to talk to you about the basics of chronic prostatitis. I'll discuss what it is, what tests might be helpful, and how to treat it. Chronic prostatitis is a very frustrating problem that approximately 8% of men will experience in their lifetime. It can happen to men of all ages at any time. First, let's review the prostate. The prostate is a walnut-sized gland that sits at the base of the bladder. It can be felt with a finger in the rectum. The urethra, which is the tube that carries urine out of the bladder, runs right through the middle of the prostate. The job of the prostate is to make some of the fluid that's important in semen. The symptoms of chronic prostatitis can be wide-ranging. These include difficulty passing urine, pain in the testicles, pain in the scrotum, groin, perineum, bladder, or anus, pain with ejaculation, burning with urination, frequency of urination, among others. There are 4 types of prostatitis: acute bacterial prostatitis, chronic bacterial prostatitis, non-bacterial chronic prostatitis, also called chronic pelvic pain syndrome, and asymptomatic inflammatory prostatitis. Acute bacterial prostatitis is very different than chronic prostatitis. Acute prostatitis includes symptoms such as fevers, chills, nausea, vomiting, extreme pain urinating, difficulty emptying the bladder. These symptoms should prompt immediate medical care, as these patients can be very sick. The treatment is antibiotics, often a urethral catheter, and sometimes even surgery if there is an abscess in the prostate. Do not wait to get help if you have these symptoms. Chronic bacterial prostatitis is an uncommon type of prostatitis. The diagnosis is made through the culture of the urine and prostate fluid. These will grow bacteria. The most common bacteria are gut bacteria like E. coli and some fastidious bacteria like ureaplasma or mycoplasma. The treatment is typically an extended course of antibiotics lasting 4 to 12 weeks. Sometimes a daily low-dose antibiotic is needed in those patients where the infection doesn't respond to the 4 to 12-week treatment. Asymptomatic inflammatory prostatitis is inflammation of the prostate that does not cause any symptoms. This is most commonly detected on a prostate biopsy or during prostate surgery. This is not an infection and does not require any treatment. This can be a potential cause for an elevated PSA, and often this is the reason why it's detected. There is no treatment that is necessary for this condition. The most common type of prostatitis is non-bacterial chronic prostatitis, also called chronic pelvic pain syndrome. This is not an infection. It will not respond to antibiotics. This is also the most common type of prostatitis. I'm going to say this again because it's so important. The most common type of prostatitis does not respond to antibiotics. In fact, in some cases, the inflammation doesn't even appear to be in the prostate, but instead is in the surrounding tissues. The common symptoms are pain in the testicles, scrotum, groin, perineum, bladder, anus, pain with ejaculation, urinary frequency, burning with urination, pain in the urethra. Treatments can include alpha blocker medications like Flomax, anti-inflammatories like ibuprofen, muscle relaxants, prostate massage, frequent ejaculation, pelvic floor physical therapy with biofeedback, sitz baths, using a donut cushion while sitting, avoiding sitting for prolonged periods of time, and avoiding caffeine, alcohol, and spicy foods. Treatment can be challenging, and not all patients respond to all treatment options. Even when cured, it can sometimes come back. For some men, the symptoms will go away without any treatment. You can continue normal sexual activity with prostatitis. It isn't clear what the cause of chronic prostatitis is in most cases. A history of trauma or urinary tract infections may be a risk factor. In many cases, there is no clear cause and no clear risk factors. There are a few tests that may be used when investigating prostatitis. These can include an ultrasound of the prostate and a camera exam of the prostate and bladder called cystoscopy. These are not always necessary, but can sometimes help to make sure there isn't something else causing the symptoms, such as a bladder tumor. The most common test is a urine culture and a culture of the prostate fluid. The doctor will massage the prostate briefly and then have you pee in a cup to examine the fluid. This can help identify any bacteria that may be present and then guide your treatment. I'll emphasize this one more time. If the culture is negative, meaning no bacteria, then antibiotics are not the treatment of choice. Here are the big takeaway points. Most prostatitis is not an infection, and antibiotics won't help. Prostatitis isn't always curable, but usually the symptoms can be well managed. You should be able to live a reasonably normal life despite chronic prostatitis. I hope that this information has been helpful. Please click the subscribe button to stay up to date on my health videos and leave any questions in the comments section below.